Mentioned today, we are wrapping up Stroke Awareness Week. It's a new report that is warning that the number of people who die of strokes worldwide is expected to increase by 50% by the year 2050. It's a massive jump. Here in South Africa, approximately 60 people die every single day as a result of strokes. The World Health Organization reporting that 15 million stroke cases take place every single year. Now, there's early identification and there's management of a stroke that can save lives. But how exactly do you detect one? Obviously, if you're not a trained professional, this interview is for you. I'm joined by Dr. Nerisha Tathiah, Regional Clinic Manager at Life Healthcare, for more on this. Dr. Tathiah, good to have you on eNCA. I appreciate the time. Can I just take us back to the very basics, if we don't mind? I don't want to assume everybody knows what a stroke is. Let's start there. What do we look for? What exactly does it do?
Excellent question. Thank you. And we need to remember this acronym called FAST, F-A-S-T. F stands for the face. So if there's any kind of weakness in the face, any kind of drooping on one side, that is an early indicator. A, if you ask the person to put their arms out and one side drifts down, one arm drifts down. S, if you ask them to say a phrase and it actually slurred, those are indicators. And T stands for time. So you have to note the time that these symptoms actually occur, and you have to immediately call the emergency services or get them to the nearest emergency center. And the reason for this is that the kind of management that needs to occur is extremely time dependent. We like to say time is brain, because the more time that is taken to get these persons to care, the more brain cells that are actually dying. And this increases the chance of complication.
We're going to talk about treatment in a moment, Dr. Tathiah. I think now that you sufficiently scared everybody, which is the right thing to do, because strokes are obviously not a joke. I was talking about those numbers before we started talking, you and I, about how common this is in our country, 60 people dying a day. How can you prevent a stroke? Is that even possible?
Yes, absolutely. Stroke is linked to diseases of lifestyle. And what I mean by that is diseases such as hypertension, high blood pressure, sugar, as we well know, and that's diabetes, which are all preventable, and other diseases of lifestyle linked to obesity, and that's having an unhealthy weight, not eating appropriately, eating diets that are high in processed food, sugar, fats, not exercising appropriately, and having lifestyles that are high in stress. And as you can see, all of these are highly preventable. And these are things that we can do, as well as managing our chronic conditions appropriately.
Treatment-wise, I imagine treatment of this is at the unfortunate moment that a stroke has taken place. I suppose it depends on the severity of the stroke. I'm not too sure if I'm using the right clinical term when I say severity, but I imagine it's based on how bad it is.
So what is important is that the individual with the symptoms gets to the hospital as fast as possible. Because if they get there within a period of time, within a few hours, within presentation of those symptoms can actually be reversed. Depending on the type of stroke that they actually have, if it is a clot or a bleed, there is actually medical management that can actually dissolve the clot. And there have been excellent results of patients that have actually gone back to their normal lives. But the key aspect is early detection using the FAST acronym and getting these patients to the care that they need timeously.
I want to ask you about the kind of conditions. You were talking about lifestyle earlier, diet, lack of exercise, hypertension, high blood pressure, diabetes, all those things that I think too many people have in this country. Is there a certain type of demographic, a certain geography in our country, around the world, that is more prone to getting a stroke? It could be age, it could be the overweight, it could be a combination, or there is some members of our country that are just more prone to it.
Mhm. That's an interesting question. And what we're finding more and more is that actually stroke can happen at any age. And this is something that everybody needs to be aware of because the risk factors can actually occur at any age as well. So, in terms of education and awareness, everybody needs to be aware of this. So, whether you're young or old and you have these risk factors, the bottom line is that you need to take care of yourself and you need to take care of your health.
I think what I was so clumsily trying to ask you, Dr. Tathiah, I couldn't think of the word, was genetics. Is there a genetics thing here? I'm so sorry. I don't know where I was going with that last question. I got there eventually. Is this a genetic issue?
Yeah. Yes, there's always genetics at play at whatever medical condition we choose to look at. But we rather look at the factors that we can control and that are preventable. And all of these ones that we've spoken about now are preventable and within our locus of control. So we really should be looking at the things that we can actually prevent. And that is our diseases of lifestyle.
Oh, Doctor, I'm going to say thank you very much, and thanks for humoring me as I stumbled around. What I wanted to ask was just genetics, and I got there eventually. Thank you for humoring me and appreciate the advice. So very important, completely preventable. As always, it comes down. It's like when we talk about diabetes, high blood pressure, hypertension. It just comes down to lifestyle. And as we heard from Dr. Tathiah, it does come down to lifestyle a lot of the time. So let me just remind you of that acronym. I'll take a few seconds to do this. FAST, F-A-S-T, like driving a car fast. Look for the drooping of the face. Ask them to be able to raise their arms. Ask them to say a phrase, or just can they speak coherently? And of course, time is the most important. F-A-S-T for FAST. My thanks to Dr. Tathiah this afternoon. We're back.